Good morning, everyone. My name is Izzy Greenberg. I run the Middlesex Coalition for Children, and welcome to Early Care Connection. Today, we have our resident panel of experts, Meryl Gay from the Connecticut Early Childhood Alliance, and Ava Bermudez-Zimmerman, who is the Coalition Director of the Child Care for Connecticut Future campaign. I'd love to start by thanking Sandra for providing interpretation for us this morning and remind all of our guests to speak slowly enough that she can manage going back and forth. A reminder to all of you that we will use the chat for discussion between the community and to note any technical difficulties you may be having, but that the Q&A is the place for questions for any of our panelists. I hope everyone had a lovely, restful weekend, and it's really nice to be with you all this morning. Today, we are going to start out with a segment on Connecticut's Blue Ribbon Panel. There's some updates that we want to get to everyone. And then we have the Commissioner of Public Health here at around 10 to speak on RSV, indoor air quality, and vaccination rates. So we have a kind of packed morning. We will, as always, be recording this and posting the recording in the next 24 hours, hopefully with the PowerPoint, so that everyone who is distracted by a crying child or just not able to give this their full attention can watch it after the fact. Okay, so let's see, Meryl and Ava, let's go to you first to talk about Blue Ribbon Panel.
Sure. So the Blue Ribbon Panel is working towards a early September first draft of their plan. They have 4 committees that have been working over the summer. Each one has done a sort of sharing out session with one of those, the final one of those sharing out sessions this evening at 5 p.m. I'll stick a link in there if you'd like to register to watch it. This is the one on costing and funding. And then the Blue Ribbon Panel is meeting on Thursday. And then the group will reconvene in September with a first draft. There will be some sort of meetings for people to see those recommendations, those initial recommendations, with the idea that then the panel will sort of revise everything and wrap it up by November so that it can go to the governor's office. And then hopefully the governor will be proposing some stuff in the next legislative session. This is a 5-year plan, so we don't expect that it will be, that everything will get done in the first year, obviously. It would help a lot if there was some more federal money to do a big expansion of the system. And that's not likely to happen before the presidential election. So that's it in a nutshell. The Alliance members, for folks who are dues-paying members of the Alliance, we have a listening session with Commissioner Bai on Thursday afternoon. That'll be an in-person with a hybrid option. If you would like to be involved, you should have gotten an email. You'll get another one later on today. But if you aren't a member of the Alliance and you'd like to join and participate in this, I will stick a link on how you can join the Alliance into the chat in just a minute. Over to you, Izzy. Ava?
I wanted to add on to that. So I know that these sharing sessions are extremely tempting for those of you on the call who are educators and providers to use the time to talk about the enrollment for Care for Kids and the wait list and other issues that might be affecting you day to day right now, in the sense of urgency that you want to fix. And those examples are definitely necessary to try to fix the system in the big picture. But I will ask of you, for the sake of the plan to think big, so when you go to these listening sessions, these sharing sessions, and you're sharing a story, a personal story, and you're talking about the hardship that you're going through, the hardship that the parent's going through, really consider what you 5 years from now needs and would like to see. The overall goal, like Meryl mentioned, it's a 5-year plan trying to really change what childcare looks like here in the state of Connecticut. So try to connect your thoughts, stories, and ideas with how that change could be long-term, right? I'll give a quick example. So in some of the most recent sharing sessions, providers took some time out to talk about the Care for Kids waiting list. And of course, no one wants a waiting list. It's affecting providers right now. It's, quite horrible, especially if you're a parent on the other end having to wait to be approved. But when we're looking at a 5-year plan, it's trying to do away with the waiting list, right? If we're trying to get the waiting list removed, then overall, we're asking the governor's blue ribbon panel to fix the system in the sense that there's more funding so that there isn't a waiting list, but also fix the system so that maybe it's not even in question in the future of childcare. So think big, think as big as you'd like, try to be as creative as you want. This is not a place to box yourselves in with what an idea of childcare should look like. This conversation should be about transformational change, should be about really making a difference with childcare and not putting a Band-Aid to what the childcare system looks like. And of course, this is your time, right? These sharing sessions are uncensored. They're opportunities for you to share those heartfelt stories. I know my goodness, we've heard so many of them during the pandemic. Many of you on the brink of closing, many of you on the brink of, worse, health and ailments and other crises that you have to go through. So don't censor yourself. If it's a difficult conversation, then take your time and make it be known to those listening that it's a difficult conversation for you to share. I will also mention that there's different organizations that we're collaborating with that are doing in-person listening sessions. And these in-person listening sessions, we do hope to have those dates very soon. We're expecting them to happen in September. Like Meryl mentioned, the final plan is due, final draft is due in November, with the expectation to be reviewed in December and then go through the process of the legislative session come next year. So there is some time still for all of you to participate. I know every time there's a hearing and there's session and, we're here advocating for you to speak up, you're going through your emotions of like, I'm exhausted, I had a long work day, I have my family. But these moments, these opportunities for you to share are so key. This is the moment for you to say you are part of changing the system. And if you miss that opportunity and everything stays the same and they don't hear from you, then we got to kick ourselves in the foot, right? That we didn't do our best to try to change the system. So this is your moment to share your story, to make sure things that aren't the same. Because we know, all of us here on these calls know that early care and education is still in crisis, and it means speaking up. So hopefully that helps give some perspective.
And just looking at the questions in the Q&A, one of them is, anyone listening? It seems like they have their mind up and they're just letting us sit in on listening sessions. What I would say is that there's a difference between a sharing session and a listening session. The sharing sessions are the the folks working on the plan trying to share out where they're at now to be able to give you some direction as to, or some sense of where they're going. And I know that that's been a little frustrating because they've been very general, you know, saying wages should go up, but not having an idea how much they should go up, or, you know, more families should be eligible for subsidy, but how much subsidy and how many families. That's all frustrating, but they're not to the point of deciding that yet. They're still trying to just sort of lay out the framework of what they're doing so that folks understand where they're generally going and then can comment on it.
Meryl, that is so helpful, because I was wondering why the different names. I swear, I'm on the website, I saw listening session and sharing session, and I'm like, is it a typo? Is it? So that's helpful that they purposely have two different formats. Okay. Very good point.
Okay, and there's another question here. Are they looking at quality versus expansion? It seems like quality session was not available for everyone to attend. The time for the meetings are hard, right at pickup at the center or commute time home.
Yeah. So the sharing sessions are all recorded, and the presentations are posted on the website. So the sharing sessions, you should, you know, those are things to look to see where they're going, as opposed to feeling like that's a time where you're going to have a great deal of input on what they're doing. It's more them sharing with us. And then there will be some listening sessions. I've heard that the Connecticut Project is planning on trying to do some sort of public hearing type sessions on the plan when there's a draft to really respond to. And on Thursday, we'll have the Alliance members will be meeting with Commissioner Bai and some of the staff working on the plan. And that'll be about an hour and a half that it'll be a in-person and hybrid meeting. There are also is a place where you can record information online to have input about if there's a particular thing that you care about that you'd like to comment on now. There's a way to do that. We'll get the link in the chat in a couple minutes. And if there's anyone from the Blue Ribbon Panel planning process who wants to add something or clarify something, feel free to raise your hand and yeah, we can call on you.
Okay, here's the link to provide feedback.
Okay.
All right, and listen, we have about 10 minutes until the Commissioner of Public Health joins us. And so if folks have other questions on Blue Ribbon Panel, but also on other things, this is a great time for that. So you're welcome to put your questions into the Q&A, because we have about 10 minutes before we move on. The other thing, well, yeah, go ahead. Was there other stuff, Ava or Meryl, that you feel that you can speak on this morning other than Blue Ribbon Panel, other things that are coming up?
Yeah, let me just say that last week we had John from SEIU on to talk about what's going on in Washington. The House and Senate are sort of each passing their own things, and then they'll have to fight out which ones are going to move forward. The House budget included large cuts to non-discretionary or to discretionary spending outside of defense, non-defense discretionary spending. That includes childcare. Members of Congress will be in district starting probably tomorrow. I've already heard that Congressman Courtney is going to be visiting a child care center on Friday. And if you hear about a town hall meeting, or you know someone in your Congress member's office that you can reach out to about trying to arrange a visit. The one that Congressman Courtney is visiting a center where he was very helpful in getting their earned their employee retention tax credit that they were really counting on to be able to bridge a gap. They had filed for it, and it had been sitting at the IRS and nobody knew where it was. And having a Congress member's office calling and pestering the IRS helped to free that up. So I don't know if any of you or anybody else is in that same situation of waiting for a employee retention credit. That's also the kind of thing that a member of Congress can do in addition to voting on bills.
We have a few questions in the Q&A, or maybe more like comments, but either way, someone says, we are not going to make it. I can't hire staff that are quality. And if they are, they need care for kids and are put on the waiting list. I've been in the field 33 years, and I think I have to put in my 30 days notice this week to the state. So thank you for sharing that. That was anonymous. We have another anonymous. Can you give us a mini overview of key ideas so far from the Blue Ribbon panel meeting? I'm not sure what to comment about if I don't know what they are thinking.
I am working on a sort of summary of all of the different work groups that I will put out on the listserv. But right now I could say that they're looking at how to make the various state funding systems more rational and smoothly operating, how to make sure that there's a way in which the various programs can touch all of the communities as opposed to just the ones that are school readiness or CDC communities. They're looking at raising payment levels and raising compensation for early educators. How much of each of those things is still yet to be determined. I'm curious to see what we'll hear tonight in the cost and funding sharing session. There are lots of things that have to be figured out. If you were trying to say, okay, how much would it cost to be able to provide a child care subsidy for everybody who can't afford childcare? You have a whole bunch of variables there. How much are you subsidizing? And that impacts on how much people are getting paid. And then how many people are being subsidized? And what's the level of subsidy? So it's a lot of moving parts trying to figure out and come up with cost estimates. And small changes in those things can result in big differences in the final number that you're looking at. That's why OEC has a bunch of consultants helping them on this project, and why they've been asking for lots of input.
Can I quickly go back to the federal? Is that okay?
Absolutely.
We do have confirmation. I'm sorry, I'm just in the beginnings of getting sick here. We do have confirmation from Congresswoman Rosa DeLauro, and she will be with us on our Monday morning meeting, September 18th. So save the date. I know many of you adore hearing from the Congresswoman and having conversations with her. So this is our opportunity to really give her a nice warm welcome back to our call. So that's again, Monday, September 18th. Monday, September 18th, she's going to be on our call. We have requests out for other federal delegation members, and we were waiting on some dates from some of the other Congress people. I know Johanna Hayes' team reached out to me, and they're very excited to join back on. They've been on our call before. We just trying to figure out some dates, and Chris Murphy, Senator Chris Murphy, same thing. There's some busy schedules here. So hopefully we'll have those dates very soon.
Great. Okay, was there anything else from the Q&A? Let's see, did we answer everything here? I think the other question, Meryl, I don't know if you answered this or not. In terms of like the key ideas, on the one hand, we want folks to be responding to what they're thinking. On the other hand, if they're missing key ideas, I mean, is there still, actually, maybe either of you knows, how much time is there? How much flexibility is there moving forward? If they suddenly are hearing something that they were not expecting, lots of people telling stories that relate to a particular thing, how much flexibility is there kind of moving forward from this point on to incorporate any new ideas or different ideas than the things that they're already kind of on their plate? Or is it sort of stuck? They've heard what they need to hear, and now they just work on fine tuning.
So, my expectation is, I think that they believe they've been working on the broad spectrum of stuff that needs to get worked on, and they're expecting they may need to fine tune based on what they hear. But if they hear that there's something that's been completely missed, I think, we can make them pay attention to it. We need to get parent voices into this process, to hear from parents about what their real challenges are. I know that there are a bunch of communities where there isn't enough preschool, and that's not the norm. In most of Connecticut, there's an adequate supply of preschool, but there are some communities where it's a problem. And hearing from parents in those communities to make sure that that doesn't get forgotten in the mix of looking at the big picture, saying, well, big picture, we probably have about enough preschool in Connecticut, and the real problem is infant toddler care. So, we need to make sure that both we're getting the big themes, but we're also getting the specific problems that parents are experiencing in particular parts of the state. And then, voices about the lack of care during the non-traditional hours is important, as well as, hearing from parent providers about the challenges they're facing to meet the demand and find staff.
We have another question in the Q&A. I heard that they are looking at Smart Start model of school day funding, and that parents will be on their own for the rest of the day/year. Full-time care will no longer be funded except for the lowest income families. Is this true? This will hurt the middle-class families.
So I know that Smart Start is one of the things in the sort of possible quiver of arrows to solve the problem. I don't know what emphasis it's going to be. There are, as I said, a bunch of communities that don't have enough preschool. One possible answer to that would be to offer Smart Start in those communities. I know that from the last time that Smart Start was proposed, that there were lots of providers who feared having the public schools eat their lunch, essentially. But we'll come back to that later. I see that we've been joined by the commissioner, and who's doing the introduction here?
Yep. Ava, do you want to? Good morning, Commissioner. Thank you so much for joining us.
No problem. Good morning, everybody.
It's great to have you with us. And for context, we have probably about 200 early care providers and advocates here this morning. These are also recorded and sent out to many, many, many more. There have been a lot of questions over the last few months as the pandemic has morphed, changed, been a little less on folks' minds, but then RSV, vaccines, all these other things, they're still present for us. So I'm so grateful for you to be here this morning to help us untangle a little bit of that and at least sort of begin a new conversation about how we think about these things moving forward. So thank you so much.
Thank you. And I thought that anticipating what many of the questions of this group might be, I do have a few slides that I thought we could share just to provide some context and then we can open it up to some questions, if I don't cover all of the important questions that people may have. So if it's okay, I'll share my screen.
It is. And just by way, I just want to make sure everyone here is, I said this a half hour ago, but this is Commissioner Juthani, who is here from Connecticut Public Health Department. And also, Commissioner, just as a reminder, we do these in simultaneous Spanish translation. Sandra is here speaking very fast. So the fewer acronyms, or at least introduce a concept, and then you can use acronyms after the first try, but just try to keep your speed in mind, and that will make it a little easier for her.
Absolutely. Thank you for the reminder, and I will do that. I wish my Spanish was good enough that I could toggle back and forth, but it's good to have a translator to do that. So
Thank you.
let me see if this works. Can you see my slides?
We can.
Okay, great. So we're going to talk about some important topics that people are probably facing in childcare right now, and that I would anticipate going into the fall will be issues for people to consider. So there are three major topics that I wanted to address today to start. Respiratory viruses in general, which will include COVID-19, flu, respiratory syncytial virus, which is RSV that people may have heard of. And then, of course, there are many other respiratory viruses that people get in the fall time and winter, but we don't have vaccines necessarily for sure for those. Then going on to air quality and environmental factors that children have been facing and all of our society has been facing, and vaccination rates overall. So for respiratory viruses, particularly for the three that we are going to have some sort of vaccine available for starting this fall, I wanted to just give some context, which we can see in this slide. So the top line is for COVID-19, and it gives you a sense over the last several years where we have seen COVID cases. Now, keep in mind that people are doing more at-home tests. Some people are not choosing to do tests at all, although I would still recommend doing that. And not everything gets reported to us on a daily basis the way it used to be. We are getting more reports on a weekly basis as we go forward. But what you can see in this first graph of 2021 till July 2023 for COVID is the blue surge over here from October 2021 through January was the Omicron surge in cases that we saw. And this past January, you can see that the number of cases we had in blue was much lower compared to that Omicron surge that we had seen the previous year. So this orange line is the previous year compared with the current year. And so our cases are way down. You may have heard some reports that cases of COVID are starting to go up. In Connecticut, we have seen a little bit up and down, but still at very, very low levels relative to what we have seen in previous years. But we do expect, as you can see, going back to October 2021 and then October 2022, that we always do see somewhat of a rise in that period of time, and we would expect that the same will be true going forward. Now, for flu, one of the interesting things is when you look at both the green line and the orange line being the year prior compared to whatever the current year listed. So for example, if this is January 2022, the orange line is January 2021. And the interesting thing about flu is because of all the masking, distancing that we were doing, there was very little flu until society opened up much more like usual. And what you can then see from October 2022 to January 23 is that the flu cases went way up relative to where they had been in the few years prior to that. Now, one thing that we do want to keep in mind is that COVID, people often say it's just like the flu, but the reality is even with everything we have, rates of mortality and morbidity from COVID are still higher than they are from flu. And so this is also true, particularly for our youngest infants. This is, for those who are 0 to 6 months old, we have seen the consequences of COVID to be higher than they were in the beginning phases of COVID. So after the Omicron wave, we found that the youngest children actually do have some of the heaviest burden. We often think about this with all our respiratory viruses, that our youngest and our oldest age groups suffer the most in terms of all respiratory viruses. That seems to be proving to be the case for COVID as well. But what we can see for flu is that now that society has opened up back to basically normal, we saw a lot more flu last year. And then the last bar graph that we have is RSV. For some people, they may not have heard of RSV before last year when we had a big surge. But the reality is that we have been facing RSV for decades and centuries. This is not a new virus. It's just one that became more prominent because with the opening of restrictions after the pandemic, what we saw was that we had a higher surge in RSV cases. You can see in October 22 to 23 of January that we had a rise that was much higher than the year prior. And also we started seeing cases a little bit earlier than we usually see, and the number of cases of children that were coming to the ICU. This is in part also because, again, our youngest of young, those in those first several months of life, are the ones that are often the most impacted by these viruses. So I just wanted to give this context because as we are now entering the fall of 2023 and going into the winter of 2024, this is probably the next year of whatever our quote unquote new normal may be. Every year that we get more experience under our belt, we get a better sense of how these viruses may compete with each other when they are infecting people who end up suffering from them. So I just wanted, again, to point to the RSV hospitalizations. As I was just mentioning, you can see this lightest blue line is 0 to less than 6 months old. And you can see that the hospitalization rate was the highest for that age group. And it came relatively early. Sometimes we see this more in the January time period. But again, seeing it this high early in the season was one of the things that was making it difficult for ICUs, particularly for the youngest children. And then as you go along, you can see that the children who are hospitalized for RSV goes down with each increasing age group. So 6 to 12 months being the next one, 1 to 2 years of age, and then 2 to 4 years of age being the lowest line in this. And similarly for influenza, this is some of what I already discussed, but just to show that there are always different types of influenza. And what happens every year is that the Southern Hemisphere experiences influenza before us because they have winter before us. And generally the strains of flu that they see circulating is what is then put into the vaccine that we get for our winter season. So they try to mirror it based on what the Southern Hemisphere has experienced, because in general, our experience is whatever they experience, we get in the following winter. It's not 100%, but we try to mirror the vaccine, the companies that manufacture the vaccines, based on what the Southern Hemisphere has been experiencing. What we are hearing from the Southern Hemisphere is that they've had a pretty tough influenza season. So this just gives us reason to, again, try to drive home the need for vaccination as a way to keep children safe and in daycare, in childcare, to be able to continue with their development. We can also see just in this bottom bar graph, just to show you that our oldest age groups, again, those 80 plus are going to be, again, the group, and it's with each decade of life, you can see that it does go up in terms of hospitalization from influenza as well. So I wanted to now turn to the second topic of air quality and the environment. So we know, many have heard about how the Canadian wildfires led to an unprecedented contamination of air in Connecticut. And health risks being associated with breathing high levels of smoke, what we have seen is that this can increase asthma episodes, difficulty breathing, and throat irritation. And when it was at its worst, DPH recommended that children and those who are older adults and people with heart or lung conditions remain inside as much as possible. We can see this coverage of what the air looked like in Connecticut during the wildfire smoke in East Hartford. One of the things that I think is most striking about air quality versus the respiratory viruses is people can see it. They can feel it. They feel their throat burning. They can see the air looking horrible, and it then changes behavior. So with respiratory viruses, we can't see the viruses. People can see people who are sick. People can see when people are sneezing or coughing in front of them. By then, they may already be getting infected. The reality with air quality is when people see it looks bad, it just makes it intuitive to say, maybe I should stay inside. Maybe I should keep the children inside because it doesn't look good. I wanted to show this slide, which is something we do here at the Department of Health called syndromic surveillance. We monitor the symptoms that people come into the emergency department for. This helps us get a sense of, is there any new syndrome, or is there an existing syndrome that we know of that is having a peak in symptoms that people are coming to the emergency department with. The first time people really saw that picture of the air quality in East Hartford, saw that the air did not look good, was around the beginning of June. And you can see here, looking at this June 4th date between June 4th and June 11th, this is when the number of episodes for people coming to the emergency department with asthma exacerbations started to go up. And the red line, when it crosses that red line, it tells us that it was a statistically significant increase in the number of asthma presentations to the emergency department. We always see ups and downs. There are humid days. There are days when the heat index is up. There are days when pollen is higher, when the ozone levels may be higher. There are lots of different reasons where air quality can be bad. And so we always do see some rise and fall in terms of asthma exacerbations. That's why when you see these other little peaks up and down, they may not have been significant, but what you can see between June 4th and June 11th is it actually looked like a significant change. And this was related to the wildfire smoke that we saw during that period of time. With our changing climate, with events like this, where something happening on a far other side of our continent is impacting air that we breathe here today, following the air quality index is a good way to be able to tell whether this could be impacting you and potentially children who are more sensitive to changes in air quality. So often you can either go to airnow.gov, or for many people, if you have the other weather app, even on your phone, the air quality index will be there. It'll tell you what the number is. And this graph, which is available everywhere, but you can just see it here so that we can go through it a little bit, is that, for example, green is when the number is from 0 to 50. This morning, I heard that the air quality index was about 24. So we're in a good place right now. Yellow is moderate. This is 51 to 100. It's generally acceptable. Most people are going to be okay, unless you're particularly susceptible. The 3 is where we usually start messaging about this, and where we start messaging about it generally to sensitive groups. And sensitive groups often means young children. So for example, if it's in the 101 to 150 range, our older adults, our children, youngest children also particularly, and those that may have any sort of lung condition, asthma being a common one, when it's in that 101 to 150 range, you do want to start worrying about this. And when it gets to unhealthy or that red range, there may be any number of people in our public that are going to feel the effects. This is from 151 to 200. Now, when we're talking about 201 and higher, that's just not good. I mean, and particularly getting to the hazardous range of 301 and higher. And during those days when we were seeing that here in Connecticut, there were a few days in New York City when it was in that maroon level of just pure hazardous. And I think it was it was in the 350 range at that period of time when people were seeing those really crazy looking skies over New York City. So this is the website I was talking about, airnow.gov. For any childcare providers, you could bookmark this for your, your computers in your facility, on your phone. Like I said, most weather apps also have this air quality index. And one of the things that's a real challenge with air quality is the southern western part of Connecticut could have one air quality. The northeastern part could have another air quality. And it could be any mixture of that over the course of the state. Because we are a smaller state, often it may impact the whole state in similar ways, but we have seen days where there are changes, and it changes over the course of the day as the air is moving through as well, which is why it's the kind of thing where you want to be able to look at it in real time, to be able to get a sense, is it a good idea for the children to go outside and play, or should we just keep them inside today? So now I want to turn to my last topic, which is one of vaccinations. And this just gives you a sense of all the vaccines that are recommended for children from birth all the way to 6 years old. And you can see that the first vaccine recommended here at birth, really within the first day of birth, is hepatitis B. The reason for this is that if a mother is infected with hepatitis B at the time she gives birth, that is a critical time where she could pass that infection onto a child. And it's one of the most common causes of liver failure in a young infant. So it's not that common, doesn't happen that often, but this is something that can be very protective for children, which is why we have this information here. The other thing to note about this is we recently looked at this data in Connecticut, and we have close to 90% of children who are getting that hepatitis B vaccine right within those first 24 hours of birth, which is good. We still have room to grow. We still have better that we can do, but that's at least good to know that a lot of children in Connecticut are now getting it right at the time, essentially, of birth. We have all these other vaccines that are recommended. And what we know is that, for example, I shared a little bit about COVID and flu and how our youngest children who are not right now recommended for COVID or flu vaccines, they need to be protected in a way because they may not be eligible to get these vaccines quite yet. They have not been tested in that age group, which is why we can't do that. But many of our other vaccines, all of our children are getting more and more up to date. Those that sort of fell behind during the pandemic, we are finding, particularly for school-age children, that they have done much better in this last year. So it's a real testament to our entire childcare community, to pediatricians, to parents, to anybody who's been involved in the care of young children. We are finding that they are getting more and more and more back on track with getting all of these vaccines that help protect not only them, but adults and our oldest adults in our society. People learned about the concepts of herd immunity during the pandemic, which means that when our youngest often get protected, it ends up protecting the entire herd, the entire community of those further at large. And that's one of the great things we've seen about this. But what we can see here is there are a lot of vaccines for children to get. But doing that really helps protect not only them, but everybody around them. And so this just shows what I was talking about our vaccination rates that for any number of vaccines, but this is looking at some of our most common ones. So measles, mumps, and rubella is this sort of turquoise line down here. The 1, 2, 3, 4th line that we can see. Diphtheria, tetanus, and pertussis is the red line. Varicella is which is chickenpox, is the purple line on the bottom. Hepatitis A is the yellow line, and hepatitis B is the one that is highest. And that's the one that I was just talking about, that really, because we've started giving that at birth to really try to protect children from the worst potential outcomes, we've done best at that. But we can see that this dip down that we took during the pandemic in 2020 to 21 is on its way up and continuing to improve. We have ways to go from where we were back in 2012 and 2013, but we are getting better and better and will continue to improve. I have confidence. And this is just to look at our demographics between white non-Hispanic, Black non-Hispanic, or Hispanic, and then all others, or multiple races or non-Hispanic. And unfortunately, what we can see is a consistent trend throughout is that our Black non-Hispanic population does lag behind in any number of vaccines that we can see here, followed by our Hispanic, and then our other or multiple races. So we can see that that trend generally is true across the board. One of the things that we are doing as a Department of Public Health is working with our local health departments to do more in-depth analyses on what those barriers to vaccination are in different subgroups in different local health communities. And once we identify where those barriers are, is trying to do targeted interventions to help bring our vaccination rates more equitably across the board at the same level. And that is the end of my presentation in terms of slides today. And we have about 10 minutes that we can, I can answer any other questions that may come up.
Great, we do have a few. Just for clarity, I think what you said for safety of children going outside, I think you said it was in the, like over 100 to 150. Is it good for folks trying to remember the numbers is a little hard? Should we just say, is it orange or yellow? Which is what's the right place where people are like, you know what, keep them in?
Yeah, I'd say orange. If you see orange, I'd keep them in. I think yellow, there may be an unusually susceptible child who maybe already, is having a lot of asthma exacerbations all the time. Maybe that type of child you might want to consider differently. But in general, I would say once it's orange, keep them inside.
Okay, that's helpful. Thank you. In terms of indoor air quality, how should folks be thinking about, changing air conditioner filters, or are there what is the risk of the outdoor air quality becoming poor indoor air quality? And what are the things folks should be doing to make sure that the indoor spaces are as healthy as they can be?
So a lot of the equipment that is used to help recirculate air and filters, I'm not an expert on like air conditioning filters and things like that, but you really want to follow and make sure your equipment is up to date. And if you have, an HVAC person or somebody who is helping maintain that indoor air quality, if you have a particular filter for pollen, if you have a particular filter for outdoor toxins, you really want to just make sure your equipment is up to speed, because that's really what's going to be best at making sure that the outdoor air quality is not impacting the indoor air quality. The other thing on that point is that, often we talk about in COVID, we would say open the windows and, let the air circulate. Well, if the air quality outside is not good, that's not going to be a good intervention. So, really keeping the windows closed, making sure that your equipment related to circulation of air, filters, HVAC, whether it be for heat or air conditioning, is being maintained so it's providing the best quality of air in your facility.
Great, thank you. All right, which of the vaccines are recommended versus required to attend childcare?
So to attend childcare, particularly, I don't have that list specifically for school. For childcare, there is one specific rule on flu vaccine, which is required for children who are attending early childhood education. And I would have to double check with our Office of Early Childhood, since we're not the ones that, we follow a recommended vaccine schedule. There's a body that, sort of discusses exactly which ones need to be for early childhood versus for education. And I have Miriam Miller, our policy director, on the call. If she's able to find a link during our talk, I'll ask her to just put that in so that we can, guide people to exactly which ones are the required ones. But I would assume your childcare agency would know that, because that's what they're doing based on, enrolling children and making sure they're up to speed.
Great. Are you comfortable with us sharing this presentation with folks after the fact with the recording?
That's
okay,
fine.
so I will give you all the link to that here in the chat before we leave, and I will also post it with the recording just so everyone knows.
I also see that there's a question about RSV. I just wanted to make one comment about RSV, because we're now going into a little bit of unknown in terms of where we're going to be, but this is going to be defined over the next week or so, I would say. So RSV, as I talked about, is a virus that for many children is just sort of a mild common cold. For our youngest 0 to 6 year olds, as you could see, that's where we had the big peak in hospitalizations this past fall. And then for our oldest age groups, that's where we see the impact. RSV adult vaccine was just approved several weeks ago. For adults, 60 and older should really discuss with their provider whether they receive it. We saw benefits for many, particularly who have other comorbid conditions in terms of getting that RSV vaccine. So adults may be one group who would consider getting that. The thing that is going to be defined in the next week or so is there are 2 different types of RSV protection that are going to be out there. One is a vaccine for children when they are born, given to the child. I'm sorry, I need to adjust that. I said that wrong. It is more of an antibody for the child when they are born, something called a monoclonal antibody. Then there is also a vaccine that is being discussed to be administered to mothers who are pregnant so that their children have immunity when they are born. And most likely, this is what is still being discussed, for any given child, either the mother will get the vaccine before the child is born, or the child will be eligible to receive this antibody. The goal of this treatment for this fall is that big spike that we saw in 0 to 6 month olds would hopefully go down, because that is the group that is most vulnerable to RSV. So there may be new things coming over the next several weeks and months in terms of how to deal with RSV in that youngest age group.
Okay, we've got 2 questions left. I hope you'll permit me to ask them both, because I know we're running up against the clock here. One is that this spring, the state legislature passed a mandatory cytomegalovirus, CMV, testing law for all newborns. Can you talk about CMV and the occupational risk to pregnant childcare providers if they catch it from the children they're caring for and pass it to their own unborn child? Is this something that our providers should be worrying about?
So a few things on this. First of all, CMV is a virus similar to EBV, which causes mono. People may have heard of mono. CMV can also cause a similar type of infection with sore throat, fever, maybe belly pain because it infects your liver. Now, many people have already been exposed to this. This is something as a pregnant professional you should talk about with your obstetrician. Is there anything else that you should be doing? Should they be screening you? Should they be checking you whether you have any symptoms or not during your pregnancy? For providers, children can certainly get CMV, but really this is something that can infect anybody throughout the lifespan. So it's not per se just because you're in childcare, but certainly as a childcare provider, as you know, you are potentially at risk for any number of viruses and infections that children bring in. So I would encourage you to talk about this with your provider. What I would say about the testing is that is not mandated right now for infants. We're going to be studying it over the next year. We're working with our state lab and with other partners to be able to figure out how this could be put into the mandate is for the following year, so not right now. And I think the main thing about CMV is to know that if you have any infection, you should definitely talk about that with your professional, your obstetrician, to know whether you need testing or not, and whether there's any specific precautions you should be taking personally, because it depends on whether you've been exposed in the past or not.
Okay, and the final question is really more about the heat and keeping children safe. There's someone saying they have a child who has asthma that seems to be exacerbated by heat. I believe they're saying that if they put the child with some cold water or chill it down a little bit, that that the asthma seems to be a little better. You know, it's been a really hot summer, and
Yes.
we have this, folks here believe in the power of play. The outdoors is really a powerful tool for keeping kids energy level and health, you know, in a good way for but when we're talking about air quality or we're talking about heat, what are the recommendations in terms of, you know, if it's a really hot day, is there things to watch out for especially, or are there conditions by which, you know what, just keep them inside, figure something else out?
So I think using the common sense that I know all childcare providers have, which is, you know, trying to keep children in the shade, trying to make sure they have a water bottle with them, trying to, you know, ensure that they keep on hydrating, being attentive to the symptoms that children are talking about. A lot of times children have a hard time, verbalizing what it is that they're feeling. But if they're nauseous, if they have a headache, they have an even harder time adjusting to heat, and symptoms of heat stroke can include some of those things. So, you know, if you have a child who's just not feeling right, you really want to get them inside and cool them off. And particularly if there's a child who has asthma and you notice that they get exacerbated, trying to keep ice around, trying to make sure you can cool them off, you know, is a good way to try to make sure that you can recalibrate them as quickly as possible. But I think shade, you know, hats, keeping them hydrated. These are all the common sense things that I know that everybody does.
And I'm sure that all of our providers don't have air conditioning. Is ice the next best thing if you think that a child may be getting overheated?
Yeah, I mean, I think that to me, I would say that is a good strategy, or even ice water if they're able to drink it, because that may help cool them off internally as well. I think that just, you know, I find that refreshing. I find that cooling. I think that, you know, many children may as well.
Commissioner, we're past our time. I'm sorry to keep you an extra few minutes, but thank you so much for being with us. There's a lot of folks in the chat saying thank you for this important information. Really grateful for what you've brought to us today. So we very much appreciate it.
Thank you. And thank you all for what you do to keep our children safe, and hope this information helps you coming into the fall season.
Great. Thank you. Have a
Take care.
wonderful
Thank
day.
you. Okay, bye-bye.
Okay, so let's see. Ava, do we have a topic for next week that's lined up, or are we still up in the air a little bit? Still up in the air. Okay.
Right now we're up in the air.
Okay, thank you. Okay, so it's summertime. I know we have folks that are in and out. We'll of course always put the recording up on the website along with that PowerPoint presentation. I've also shared that in the chat. I see that Joanne has shared some information about CMV. Thank you for that. I also put the CDC, Center for Disease Control and Prevention, had some really good information on RSV. So I think always the CDC is the place to go when you have questions about a virus, how to keep kids safe. Certainly the Connecticut Department of Health is going to give you the most accurate information for what is happening in our state. But if what you need is information on the virus, on they have some great infographics, how to keep kids safe. The CDC website is a great place for that. Okay, so we will come back together again next Monday. I hope everyone has a great week. Thank you to Ava and Meryl for providing your expertise. Thank you to Sandra for translation this morning. As a reminder to everyone, because we do have these new Zoom backgrounds, it was with some shuffling of folks in different positions. It was a little bit hard to work out the sponsorships for this call, and so we've just changed it to Early Care Connection just to simplify life for ourselves and for all of you. So don't mean to confuse anyone with that, but it just seems like an easier way to go. But same group, same expertise, same advocacy, same knowledge, and same community. So nothing has changed other than our background. Thank you all so much for being here. I hope you have a wonderful week, and we will see you next week.